Good evening, madam. My name is Harsha Kaur from BMI Cohort 10, and today I'm going to be talking about the female reproductive system. Okay, so I have chosen Hysterosalpingography (HSG), which is known as which is also known as uterosalpingography, which is a radiographic procedure which requires the use of a contrast agent to evaluate the uterine cavity and the fallopian tubes under fluoroscopic guidance. Okay, so this is the anatomical part of the female reproductive system. Okay, so next. Okay, so the indication of a woman who have to undergo HSG procedure would be infertile women, which mean a woman who has a history of miscarriage, pelvic pain, tube ligation, which refers to the procedure which would require the closing of a fallopian tube, and many more. Okay, so we're gonna dive in straight to the procedure before they conduct the examination. Okay, we need to know the patient details first. So we need to know the patient's name. We need to know whether the patient is outpatient or inpatient. We need to know whether the patient is pregnant or not, whether the patient is allergic towards iodinated contrast materials, or any history of medical conditions. Okay, so patient preparation before the examination. So basically, the procedure must be conducted during the proliferative phase, which is the phase after menstruation phase when the endometrium wall is at its thinnest. And then the patient also must avoid having intercourse from the time she has a period until after the procedure to avoid getting pregnant. And then the patient's bladder must be empty. Painkillers may be taken by the patient as well, and the removal of clothes and to wear the hospital gown before the examination. Okay, so as for radiation protection, so the radiosensitive tissue located outside the region of the interest must be shielded, and then for the radiographer and the staff must wear lead gown during the procedure. Okay, so during the procedure, so the patient will be lying on the fluoroscopy table, and then the AP scout image of the pelvic cavity will be taken. So after taking the preliminary film, the patient will be placed in lithotripsy position, whereby the patient will be lying down and the knees are flexed. Then the speculum is inserted into the vagina to clean the cervix and insert a catheter. Okay, so basically there are two types of methods, two ways for the contrast media to be inserted into the body. The first method would be the insertion of the cannula, and the second method would be the insertion of the insertion of a balloon catheter. Okay, so the first image shows the insertion of the cannula, and the second image shows the insertion of the balloon catheter. Okay, so the patient is then placed in a slight Trendelenburg position once the speculum is removed. So once the speculum is removed and the patient is positioned, the fluoroscopic image is taken once the contrast material is injected slowly into the uterine cavity, fallopian tubes, and the peritoneal cavity. So once that is over, once the images are taken, the cannula or the catheter will be removed from the cervix. Okay, so the patient care during and after the procedure. So the patient must be comfortable throughout the procedure. Care must be taken when inserting the catheter into the cervix to avoid any bleeding or injury. The antibiotic is given after the procedure, and the patient will be informed about vaginal spotting for the next 1 to 2 days. Okay, next, image analysis. Okay, so basically the image form, you can actually see the pelvic ring at the center of the collimated field for an AP projection. The cannula or catheter can be seen within the cervix. The opacified uterine cavity and uterine can be seen as well. Okay, so that is basically all. This is the reference. That will be all from me. Thank you.